Hi, good evening everyone. Welcome to my presentation. Today again I am back with some important MCQ in child health nursing. And here you can see the first question. If birth weight of the newborn is below 1500 grams, which is appropriate place to care the baby? If birth weight of the newborn is below 1500 grams, then which is appropriate place to care the baby? And the options are care at home, primary level hospital, or care at secondary level hospital or tertiary level hospital. And the answer is D, tertiary level hospital. If the baby born below 1500 grams, then we must care the baby in tertiary level hospital. Then here you can see if birth weight of the baby 1800 grams, then we have to treat the baby at home, no problem. Why? Because here the normal birth weight of the baby is 2.5 kgs to 3 kgs or 2500 grams to 3000 grams. So 1800 grams is near to 2000, so we can treat the baby at home, no problem. Then if the baby born 1500 to 1800 grams, then we have to send the baby or we have to treat the baby under secondary level treatment. And next, if the baby born 1500 grams, then we have to treat the baby under tertiary level. Then next, second question, head circumference at birth. Head circumference at birth, and the options are 15 centimeters, 55 centimeters, 35 centimeters or 75 centimeters. And the answer is average head circumference of a baby at birth is 33 to 35 centimeters. Then next, third question, when should measure head circumference of a neonate? When should measure head circumference of a neonate? And the answer is options you can see after 12 hours, 48 hours, 72 hours or 6 hours. And the answer is 48 hours. Why? Because the head circumference we must measure after 48 hours because of molding. Okay, so without molding, if you are measuring head circumference of a neonate, it gives the false measurement to you. So that's why after molding, nothing but after 48 hours, we should measure the head circumference of a neonate, then we will get the correct measurement. And you can also see here at 3 months, the head circumference of a baby is 40 centimeters. And at birth, the head circumference is 33 to 35 centimeters. Average chest circumference at birth. Average chest circumference at birth, and the options are 15 centimeters, 55 centimeters, 35 centimeters or 38 centimeters. And the answer is chest circumference 30 to 33 centimeters, or head circumference already we discussed, that is 33 to 35 centimeters. And here you can see one important point between head circumference and chest circumference. At birth, chest circumference less than to head circumference is less than to head circumference, but at 1 year chest circumference is equal to head circumference. And here you can see the head circumference 33 to 35 centimeters and chest circumference you can see 30 to 33 centimeters. Just you remember this hint, H triple C, nothing but here at birth HC less than to CC, and at 1 year HC is equal to CC. Okay, 3 C's you can write after H if you have any confusion. So just you remember this hint. At birth chest circumference less than less than to head circumference, and at 1 year chest circumference is equal to head circumference. Okay, then next question, normal head circumference of newborn at ranges from HCC, you can remember 35 to 38 centimeters, 31 to 33 centimeters, 30 to 33 centimeters, or 33 to 37 centimeters. Okay, here the answer is 31 to 33 centimeters here given, but up to 35 centimeters, that the head circumference we can range. Okay, up to 35 centimeters it will be there. Okay, then next, optimum head circumference will be 45 centimeters at. Optimum head circumference will be 45 centimeters at 10 months of age, or 12 months of age, or at 8 months of age, or 6 months of age. And the answer is at 12 months of age. Already we have discussed at the birth the head circumference is 33 to 35 centimeters, and not only that, at 1 year or 12 months the head circumference is 45 centimeters. Then at which age head circumference equal to chest circumference? Options, at 1 year, 2 year, 3 year, or 4 year. And here the answer is 12 months or 1 year. Already we have discussed in previous question, right? At 1 year chest circumference is equal to head circumference. So here based on this point again they had question, they asked question, what is that? At which age head circumference is equal to chest circumference? That is 12 months or 1 year of age. Then sole creases in term neonat are. Sole creases in term neonat are present at, here you can see options. Sole creases in term neonat are, option A, absent near heels and evident over heels only, or spread over entire foot, or option D, present only on toe tips. And here the answer is spread over entire foot. So what the question mean that here sole creases in term neonat. Term neonat is nothing, baby born between 37 to 42 weeks, so that baby we can call the term baby. And in that term baby, so where we can see the crisis, so spread over entire foot. The next question, all following are the major problems affecting child growth and development except. Here the options are common cold, B, malnutrition, measles, and pneumonia. And here the answer is common cold. Common cold never affect the growth and development in children, but malnutrition, measles, and pneumonia, these are the disorders or problem or major problems affect the child growth and development. The next question, which of the following example represent parallel play? Which of the following example represent parallel play? The options are Jenny and Tommy shares their toys, Jimmy plays with his car beside Mary, who is playing with her doll, Kevin plays a game of Scrabble with Kathy and Sue, Mary plays with a handheld game while sitting in her mother's lap. So here what the question asks, meaning of this parallel play. Okay, so by seeing these four options, just you can guess what is a example of parallel play. And here the answer is D. So before getting this answer, first we have to learn what is the exact meaning of parallel play. The parallel play is nothing but children's play adjacent to each other, but they do not interfere one in another. They won't share their toys. So separately they used to play with their toys. So that we can call the parallel play. Children's play adjacent to each other but do not interfere one in another. So that type of play we can call the parallel play. Here you can see the Jimmy plays with his car beside Mary, but this Jimmy not at all disturbing this Mary or not interfering in this Mary's game. So Jimmy playing separately and Mary playing separately, but both are playing adjacent to each other without sharing their dolls. So that type of play is called parallel play. And here you can also see parallel play we can also call the independent play or play by themselves. And not only that, child plays along the side other but not within other children, and it is a characteristic of toddler. In toddler, nothing but 3 years, in 3 years age of child, we can see this parallel play. Okay, next question. Type of play exhibited by toddler when they play themselves in the presence of other children. And already we discussed what is that options. You can see parallel play, solitary play, or cooperative play, and the answer is parallel play. In toddler we can see the parallel play. Okay, and here solitary play we can see in the infant, or we can also say that onlooker play, solitary play, or social affective play we can see in the infant, and toddler play we can see parallel play we can see in toddler, or therapeutic play we can see in toddler, and associative or cooperative play we can see in preschooler age. And not only that, competitive play with rules and rituals we can see in school age children, and not only that, games and athletics with strict rules we can see in the adolescent age group. Characteristic play present among toddlers. Characteristic play present among toddlers, and here the answer options you can see: parallel play, associative play, cooperative play, onlooker play, and the answer is parallel play. And play during infancy is important because characteristic play present among toddlers is, and the answer is parallel play. The next here you can see the options. Play during infancy is important because it enhances social development, emotional development, cognitive development, or physical development. The answer is social development. The next question. Which of the following statement not true regarding associated play? Here you have the options. Children involved in identical activity, children borrow and lend play articles, mutual goal is set, no establishment of rules regarding the limits of play section. And the answer is C, mutual goal is set. Here, what is actually associated play? Children play together without setting any goals and rules. So here they asked not to true. Which of the following statement is not true regarding associated play? So A is the true. Okay, A option is true. Children involved in identical activity and children borrow and lend play articles. No establishment of rules regarding the limits of play section. Except, so this one, mutual goal is set. Actually, what is the associated play? Associated play is nothing but children play the games without setting any goals and rules, and that type of play we can call associated play. Together they are playing without making any rules and or without developing or without keeping any rules and regulations between them, and that type of play is called associative play. And this associative play mainly we can see in preschoolers, and we can also see, call this first stage of play. And this associative play is also increases social interaction between the children. Example, you can see same block building by each other and tricyclic riding by each other without designing any rules and regulations. Okay, then next question. Play for the preschool age. Play for the preschool age child is necessary for the emotional development. For which emotional development the preschooler age children has to play? And the answer is introspection. Nothing but here, when preschool children playing, So which emotional development we can see during playing this preschooler age, in this preschooler age? And the answer is introjection. Introjection is nothing but, what is the introjection? Here you can see identification of self with another person, or identifying themselves with the adult. So that we can call the introjection. Nothing but during preschool age, when they are playing, so they develop introjection emotion. So what is the introjection here? Self identification. When they go for playing with other school children, then automatically they can develop self identification capacity. So that we can call the introjection. And feeling of competition. Feeling of competition we can see in school age children, not in preschool children. So preschool children we can see introjection method. How blood loss measured in postpartum hemorrhage? How blood loss measured in postpartum hemorrhage? And here the options you can see: by estimating blood loss in number of pads, or by weighting the sponge absorbed with blood, and by monitoring pulse rate and BP, or by counting hematocrit count. So here the answer is by estimating blood loss in number of pads, or by weighing the sponge absorbed in the blood. The next, the traction used in the cervical spinal injury. Answer is halotraction. Halotraction is used to treat the spinal deformities. Okay. The next question. Next question. The umbilical cord dry and separated by aseptic necrosis. The umbilical cord dry and separated by aseptic necrosis in? Answer in 3 to 5 days, or 9 to 12 days, or 5 to 8 days, or less than 12 days. And the answer is 5 to 8 days. Then here you can see 5th day umbilical cord dry. Umbilical cord dry at 5th day, and not only that, umbilical cord completely falls at 7th day by aseptic gangrene process. The next one, most important need of newborn at birth are? Most important need of newborn at birth are: hugging and kissing, bathing and wrapping the child, clear child airway and maintain temperature, keep the child in close contact with mother. And the answer is C, clear child airway and maintain temperature. So these are all the important need for newborn, but in that the priority one is clear the airway and maintain temperature. And here you can see airway clearance. The purpose of airway clearance is to prevent the asphyxia in baby, and maintaining temperature is to prevent the hypothermia in baby. The next one. Next, the practice of keeping mother and child together, called immediately after birth, known as? The practice of keeping mother and child together immediately after birth, known as roaming in, puperia, lying in, bonding. And the answer is A, roaming in. Then the here the newborn should always close to the mother. The newborn always close to the mother because for attachment, parenting, caring and bonding. And the answer is D, bonding. Then next question. Actually, what is the mother and infant bonding? So mother and infant bonding increases emotional and physical attachment between infant and mother, and not only that, it should be initiated within first hour after normal delivery of the baby. And not only that, it is also increases the mentally healthy, it is also increases the mental capacity in infant, and not only mother relationship. And that's why we can call mother infant bonding also mother infant attachment. And here they give an option. What is that? Parenting. Parenting is nothing but caring and raising a child or producing offspring. The next question. If newborn If newborn baby doesn't breathe immediately after birth, then flick babies. Tip of toes, palm of hands, sole of foot or tips of fingers. And the answer is C, palm of hands. If newborn doesn't breathe immediately after birth, then have to flick baby's palm of hand. NICU stands for options: newborn intensive care unit, neonatal intensive care unit, neonatal intermediate care unit or newborn intermediate care unit. The answer is neonatal intensive care unit. The next question, all following are the immediate care to be provided to all infants except, and here the options are, you can see, provide warmth, breastfeeding, immunization, prevention of infection. In that, what we should avoid? And the answer is B, breastfeeding. Not B. Sorry, B, immunization. So immunization after birth like BCG, oral polio vaccine, hepatitis dose, which we give after birth, is not a immediate care, of newborn, but except this immunization, providing warmth and breastfeeding and prevention of infection. So these three are immediate care for infants. Then what nursing intervention best meets a major development need? Meets a major development need of newborn in the immediate post-operative period. What nursing intervention best meets a major development need of a newborn in the immediate post-operative need? And here the options you can see: give a pacifier to the infant, put a mobile over the infant crib, provide the infant with a soft cuddly toy, warm the infant formula before feeding. And the answer is A, give a pacifier to the infant. Pacifier is nothing but it is an artificial nipple made up of plastic, and it provide to the infant for satisfying their sucking need. Why? Because here the mother is in post-operative period. So at the time, if the mother unable to give the feeding to the baby, and immediately we can satisfy the sucking need by giving this artificial nipple called pacifier. Then giving immediately after surgery this pacifier will satisfy sucking need of infant, and it is the priority need during this period. Then next, and not only that, without returning the peristalsis in the baby, the mother should not start the breastfeeding or formula feeding also. So that's why before feeding we have to activate the peristalsis movements in the infant by using this pacifier, and then encourage the mother to give the breastfeeding. Then 3 months old is in nothing by oral for surgery, and the nurse attempts to comfort him by administering acetaminophen, encouraging parents to leave so the child can rest, offering pacifier, and giving 10 cc Pedialyte. The answer is C, offering pacifier. Which of the following is used for assessing the pain in children? Options are brief pain inventory, visual analog scale, numerical rating scale, and Wong-Baker faces pain scale. And the answer is Wong-Baker faces pain rating scale. And which pain scale will you use in fully conscious adults? And the answer is options you can see: numerical scale, Wong-Baker scale, Ask a patient to tell if it is low or moderate high, any of the above. And the answer is A, numerical scale. Numerical scale we can use for the adults for checking consciousness, and nothing but for conscious adults who has the pain, and for the children we can use the Oak Baker face pain scale. And not only that, here I written. Okay, the next one. In critical care pain observation tool, which facial expression has been given score of 2? Relaxed and neutral, tense, grimacing, shouting. And the answer is grimacing. So clearly we can discuss actually what is the critical care pain observation here. So critical care pain observation tool is used to check the level of pain in the critically ill patients. Critically ill patients is nothing but who are incapable to say their pain. For them we can use this scale, critically care pain observation, to assess their pain. In that we can check 3 parameters. One is facial expression, body movements, or muscle tension. And so this critical CPOT we can use in the people, intubated patients, sedated patients, and unconscious people. And here you can see, first in this facial expression we used to check whether is he relaxed, or he has tense facial expression, or grimacing. So here if the person has relaxed, have to give the 0, tense +1, grimacing +2. So this question they asked here. In critical care pain observation tool, which facial expression has been given score of 2? So when you can give the score of 2, when you are assessing the facial expression in the critical care patient. So if the person showing grimacing, so we have to give the +2 score. And not only that, you can also check the body movements and muscle tension. And here if body movements are absent, we have to give the 0 score, and if he is protecting, then we can give the 1, and if the body movements are listlessness, then we have to give the +2. And here the muscle tension, relaxed 0, tensed or rigid +1, very tensed and rigid +2. The next question, visual analog scale is mostly widely used to measure, and the answer is pain intensity. The next pain scale in clinical setting is an example of visual analog, semantic differential, graph rating scale, checklist, and the answer is visual analog. Then most appropriate method for assessing pain in toddler. Options: assessing for change in the vital signs, use a numerical pain scale, observe the child for restlessness, or ask the child about the pain. The answer is observe the child for restlessness. Appropriate time for toilet training: 0 to 1 year, 6 months, 3 to 6 years, 1 to 3 years. And the answer is D. D, 1 to 3 years. The D, 1 to 3 years. And here you can see, end of 18 months, the child doesn't have the neuromuscular control capacity, nothing but neuromuscular control of bowel and bladder. And so what we have to do at 18 months as a parents, they should advise we should advise the parents to train their children before 18 months. And not only that, at 2 years as a parents, they need to start toilet training to their children, and at 3 years then children can hold and postpone their bowel movements. Child can withhold and postpone his bowel movements at the age of 1 year, 2 years, 1 year, 2 years, 3 years, and 4 years. Child can withhold and postpone his bowel movements at the age of, and the answer is 3 years. The next question, toilet training should be started at the age of infant, toddler, preschooler, school age, and have to start at the age of, and here you can see the answer is toddler.